have with me Representative Ray Jeffers from Person County. He represents Person County and some of Durham County. And we're very happy to have you today with our podcast. You're sort of kind of helping us kick off our community series of podcasts with some, people that we wanted to come and share a little bit with us. So, today, we were going to just sort of let you do some things in the beginning, talk about yourself, give us some things about where you come from and who you are, and then we'll take it from there.
Oh, yeah, well, good morning, and thank you all for the invite. Ray Jeffers, I represent North Carolina House District 2, which is all of Person County and the northern portion of Durham County. Have about 55,000 citizens that I represent here in Durham County. And so this is my second term there in the North Carolina House. Served 3 terms, 12 years in Person County as a Person County Commissioner before going to the House. And it's hard to believe that I'm coming up on my 18th year of elected and appointed office. So it's been
Wow.
quite some time. I was first elected in 2008. At that time, the youngest county commissioner in the state, and have enjoyed my service not only to my citizens in Person County, but to the state in the whole. And was served as president of the North Carolina Association of County Commissioners, which I think really sparked my interest of going down on Jones Street and working, because I was there quite a bit in Raleigh advocating on behalf of counties as the president, and was still the youngest president ever elected. I was sworn in the day before my 30th birthday as president of the association.
Okay.
So they afforded me a lot of opportunities, I think, to learn about a lot of different issues that affect not only the folks that we serve, but our state in the general. And so I've enjoyed my time. Person County, born and raised, family farm there, still farm my family Century Farm. We'll be 107 years in January.
Wow.
And
Okay.
so very excited about that, and kind of keeping that legacy going. And then I do some work for some nonprofits around just support of small farmers, and particularly BIPOC farmers in the South.
Okay. Okay. All right. Very good. And I know you have a couple of hobbies and stuff that you like to do, and anything you want to share there?
Well, a lot of people don't know. I'm always asked, kind of the icebreaker, what someone may not know about me is that I'm a movie accredited dog trainer. And so I had a dog in a movie about 10 years ago that starred Kate Beckinsale and Gerald McRaney,
Yeah.
called The Disappointments Room. And the Black
Yes.
German Shepherd in that movie is my dog. And I've trained dogs since I was about 15, and for a sport called Schutzen. And so the dogs participate. It's a German sport. They participate in doing tracking, obedience, and protection work.
Hmm.
And most recently, the first of this month, I became a judge in Schutzen. And so I'll be trialing. I've been invited out to judge my first trial next week, actually, in
Wow.
Arizona. So,
Oh, okay.
so
Great.
that's something most people don't know about.
Yeah. I knew you did some of that, but I didn't quite know it was to that extent and stuff. So very good. I've seen some dog trainers that, be on the trail where I go to run and stuff, and they have their animals out there
Mhm.
helping them to be obedient and I guess listen for their owners and whatever. But that's
We use you runners for distractions.
I love that. I know it's like, wow. And they will chase you too and stuff. Very good. Okay. Um, so let's just talk a little bit about since you've been at the General Assembly. Now, this is your second term, you say, because I guess, what is it, 2 years you serve before it's voted, or is it 4 years that y'all
We have 2-year terms.
2 year terms and stuff? Um, and you know that here at DECI, we work with adults with special needs. And the largest population that we serve are individuals with intellectual and developmental disabilities. And I know you've been involved in Person County a lot when you were serving up there in your capacity of the county commissioner, working with the program up there that's similar to ours. So just talk to us a little bit about, that experience and stuff, what you did with them, or, those kinds of
Yeah,
things.
so mostly that's I would say my familiarity to the program. That's again similar to what you all do here, and just familiarity to the services that are provided to our citizens with disabilities. And so, as a county commissioner there, of course, probably some time ago, that program was absorbed into the county, way before I got on the board in 2008. But it was absorbed in as a county department, as
Oh,
a county government. So it's actually a function of county government there in Person County. And so learned quite a bit about again those services that Person Industry provide. when I was a county commissioner, and so I've always tried to do my part as a commissioner to support them, particularly as they went out to get contracts and things like that for the work that they needed to done. And one thing that I supported when I was on the board, which was new to them, was creating a uh, material recycling facility, a MRF.
Okay.
And so that really was able to provide a number of jobs for the clients that they serve, as well as a services to the county that we really needed.
Yeah.
And I can tell you through that we were able to attract other companies, particularly that dealt with recyclables, to come to Person County because we had this county-run MRF there
Okay.
on site that was supported by county government, and then of course, like I said, Person Industries operated that.
Mm-hmm.
And so, before people had to separate all their recyclables and and put, different containers, now we came to, well, you just put everything in one box, drop off there at our facility, and that provided jobs for sorting and things like that. And
Mm-hmm.
of course, by sorting those, we were able to capitalize on uh, different contracts for mixed papers and plastics and things. Instead of selling someone everything grouped together, now we
Yeah.
could get more for particular items and stuff because they were separated. And so we had a company that came and built um, outdoor furniture from recycled milk jugs.
Wow.
So one of the biggest things as a commissioner when we were talking to that company about coming to Person County was, hey, we have a county run MRF here and
Mm-hmm.
could provide those items for your need.
Right. And that furniture company is on the closer to a South Boston. Is that the one
Correct.
that's up there? I've
Mhm.
heard a lot about it. I just haven't gotten up there to see it, but I've heard a lot. And so they actually do sell furniture to the community and stuff like that, or?
Absolutely, yeah. They have a
Mhm.
few stores there in Person County that they're in, but they, obviously sell nationwide. I was vacationing down in Myrtle Beach, and the place that we were staying, it was all of that furniture from that company.
Wow. Okay.
So yeah.
I would definitely have to look into that. Since Person County is my county and stuff. I don't think I said that I'm also from Person County originally. So very good. So yeah, so it seems like your experience working with programs like ours is pretty vast, and and you understand the nature of what it takes to actually, to provide services, because it's not easy to get the work in that we need to do job training, because programs like Person County and Durham Exchange Club Industries, we're about doing job training, job skills training, teaching good work habits and skills, so that hopefully for those individuals who can go to work in the community, they can be a very good employee for the company they're working for, but also for those individuals who cannot actually go to work. It gives people a place to come and be safe, getting structure that allows parents to do what? Go to work and, and sort of, provide for their families. And I don't think a lot of folks understand that.
Yeah, absolutely. And I think, that was one of the biggest things that your program and the program back home, is understanding the partnerships that are involved, not only with businesses, but with the community and the families that you serve, and to just educate, I
Hmm.
think, the community and the folks that, our citizens with disabilities and clients that you all serve, they are employable.
Hmm.
And so, that's important.
Yeah, absolutely. So while you've been in the General Assembly, when it comes to, bills or co-sponsoring bills and things that relates to the services that Person Industries or DECI sort of, provide and stuff, do you have any particular things that you have worked on with anyone or done?
Yeah, so I serve on. We're all we're asked what committees we would like to serve on. We always don't get those. I was fortunate that I got committees that I think were in my wheelhouse. For instance, I serve on the appropriations, agriculture committee,
Okay.
local and state government, and wildlife, as well as um, our public utilities and energy committee.
Hmm.
And
Okay.
so there's really kind of in my wheelhouse, particularly for I think the area that I serve. But my seatmate, Representative Hawkins, who I know is a very good friend of you all in the program here, he kind of leads that caucus,
Hmm.
that ID caucus, and so I really kind of lean towards more of them, and when he's kind of driving that legislation to kind of make sure our co-sponsors can support where I can,
Hmm.
but obviously not my expertise, and I try to kind of follow his lead on that.
Right. Okay. Yeah. Very good. Very good. We need all the support we can, no matter what. And when it comes to the services and funding that we need for individuals with whether it's disabilities or just people who need certain services.
And I
So that.
think that's probably one of the areas he's really tried to educate us on, particularly around the funding and kind of the mix of funding that it takes to
Mm-hmm.
operate the programs that you all operate, and just where it comes from and how
Right.
one little interruption
Yes.
can make a ripple effect. And so that's one thing I've glad he's been trying to educate us a little bit more on.
Yes, yes, indeed, and that can sort of lead us into the discussion of what's going on in the state right now with this Medicaid crisis. That's of course coming down from our federal government, the lack of support and funding that's beginning to come from them. And that ripple and that trickling effect is going to really affect services that programs like ours provide to individuals around the state, along with the fact that a lot of people will not maybe be able to get the insurance that they need and might not get to keep the insurance they need
Mhm.
to make sure they're healthy, their families are okay. So just talk to us a little bit about how what you see with that, and what do you think North Carolina can do to continue to support their citizens?
Well, we could fund we could fund it,
Okay.
and we have a contingency fund
Hmm.
for Medicaid that is sitting there with about $500 million, I think, sitting in it. So it wouldn't, obviously we wouldn't want to deplete all of our
Sure.
rainy day funds, so to speak, but we definitely could delay some of these cuts until
Hmm.
hopefully a solution is found. We've been uh, talking about this since the spring that it was coming,
Hmm.
and unfortunately, the General Assembly leadership just can't get it together right now to agree on much. And so here we are in October with no state budget.
Hmm.
And so we thought, DHHS can't continue just, you know, kind of putting things off, and delaying the cuts with no money, or they want to spend all of their contingencies that they to use it elsewhere. And so we came out of session in the summer during the summer break, and they delayed a lot of things, I think, for 3 months because we were supposed to come back in September. We didn't come back in
Hmm.
September. And then we went back last month in October for 3 days, and we didn't do anything. And, we passed in the House a bill that would put some money there, but it was contingent on the Senate taking it up. Well, the
Hmm.
Senate adjourned the day before we did. So
Hmm.
it really wasn't worth the paper it was written on, knowing that the other chamber had already left Raleigh for what they have told us now the rest of the year.
Well.
And so here we are in November with no budget, with a crisis that we knew was coming
Hmm.
for months,
Right.
and we have the funds again to delay at least in the contingency. And I think from some of our um, uh, other things that we have been funding in the state that some of
Hmm.
us think may not be a priority, we could use those funds and fund it in full. I think the state has told us to fund it in full. We're looking at somewhere a little over $800 million.
Hmm.
Well, we put those in other things
Hmm.
that I might not agree with,
Exactly.
but here in Durham, we have about 340 some thousand citizens. About 22% of those are Medicaid eligible.
Right.
We picked up about 16,000 of those doing Medicaid expansion.
Expansion. Hmm.
And so, we're playing politics with people's lives.
Right.
And I think that's what the community needs to know. And people just need to understand that people are going to hurt behind
Oh
this.
yeah,
And
and it's not a partisan thing. It's not whether you're Republican, Democrat, or whatever. It's going to be hurt across the board.
absolutely.
When people
And
don't have health insurance and stuff. So.
yep. And fortunate in an urban area like Durham, we have other resources,
Hmm.
but when you get to our most vulnerable areas of the state, particularly our rural areas,
Yes.
uh, they don't have as many people, but they're really going to hurt because they don't have the services. And
Exactly.
and particularly, I think our rural hospitals and county-owned hospitals, they're not going to be able to survive
Yeah.
without those funds.
Absolutely.
And those providers that have agreed to go to those rural areas, knowing they're not going to get rich by going there, but they're
Right.
going to service for those areas, they depend heavily on that as well.
Hmm. And that puts us back over, 50 years now, or more than that, I guess, when there's not enough healthcare things that people can go to in their rural areas. You have to travel 30, 40, 50 miles just to get, emergency care. That's just not acceptable,
Yeah.
anymore.
And transportation is obviously an issue for those areas. Um, but again, I grew up in a rural area. You're from Person
Hmm.
County, so but I tell people, we don't have babies in Person County anymore because we don't birth enough to support OBGYN
Yes,
there, and
yes.
so uh, that's very real in other specialties and areas of medicine
Right.
for us in those rural areas, and so it's going to be tough.
Yeah. Do you think that the state of North Carolina, I remember just mentioning to you that could we do things like all the businesses coming in, maybe tax them differently to put more monies towards maybe healthcare, or I, I think somewhere I heard that we're not even taxing some of the business that come in now and stuff like we used to. Like I have a part-time professional cleaning business, and I am licensed in Durham, and I used to pay a yearly license fee, and they stopped that. And they said it was, trying to get more business to come in, but not asking them to meet, carry their fair weight and stuff. I mean, is that true in terms of North
Yeah, so
Carolina?
that, I mean, that is the reason why we don't have a state budget. Our leadership on both sides agreed to these corporate tax cuts that were triggered by a certain level. When North Carolina reached a certain amount of revenue, then
Mhm.
it would trigger a lowering of the corporate tax. We already currently have the lowest corporate tax in the country.
Mm.
And so, what we are hearing from our nonpartisan staff
Mhm.
is that if we continue down this road with the revenues we have and these tax cuts, we're going to hit a fiscal cliff by 2030.
Yeah.
And so that has been, I think, the biggest issue. I think House leadership sees it. Of course, my caucus sees it,
Mhm.
and think that we should halt these cuts immediately. At least the leadership in the House, I think, would want to halt them temporarily until we can figure out, fiscally what we're going to do.
Right.
But my understanding, the Senate has not wanted to do that, and so that's why they cannot agree on a budget.
The
But you're absolutely right. I think if we halted those cuts, or even we just went back to the levels that we were before,
Mhm.
we could fund a lot of things,
Things, yes.
including healthcare
Right.
and some of the funds I think we're putting in private institutions like private schools and things like that. That
Right.
is not, in my opinion, what we should be doing
Right.
as a state when we have a public school system to support. We could easily fund this crisis here.
Right, exactly. So, what would you say to your voters, in terms of what should we be doing? Should we pretty much every day when you go back in session be over there at the legislation talking to, the people about, what we need, what the citizens really, desire and stuff? Is that one of the things we could
Absolutely,
do?
I think advocacy is a good opportunity, and I think it really bodes well or has leverage on those that are making these decisions. I mean, we hit an issue this year with want to take away shrimp trolling down in the coast, and it looked like all of the eastern North Carolina showed up, and guess what? There wasn't a bill. And so, well, there was a bill, but it didn't get heard.
Didn't get hurt.
And so I think advocacy, definitely has a part here,
Hmm.
and mainly telling your story. I mean, and how it really affects you, because I tell people, when I was a county commissioner, I was right there. I saw my constituents everywhere, at
Right.
lunch, at Walmart,
Hmm.
wherever, and so, just the hour drive to Raleigh, it does, create that little distance there, because by the time I get back, it's 9 o'clock at night. I don't see as many folks as I used
Right.
to.
Exactly. Yeah.
And so I think that's even, of course, truer with our federal delegation who's in DC, and they're, from my district, 4 hours from me, right? And
Hmm.
so, um, I think just reaching out and making sure that myself and those that have asked to serve you understand the challenges, the everyday challenges that
Hmm.
that they're facing, particularly as it relates to healthcare in this crisis, and
Right.
from the providers that they're going to see, or from the insurance rates that are going to increase,
Hmm.
that they're no longer going to be able to afford,
Right.
and which is going to put a strain on our hospital emergency
Hmm.
rooms,
Hmm.
and who are already more likely shortly staffed. And so I think just really putting it in layman's terms and telling that story on how it's going to affect your family would go a long way.
So we were talking about, our people go to Washington that represent us from our different areas and stuff, our congressmen, and um, and how if we feel like certain things that laws or federal laws that really don't serve people that we serve very well in terms of gaps and in those laws. Like for instance, one of the things that we're under now, not just DECI, but all community rehab programs. There's a law called the WIOA. It stands for Work Opportunity Investment um, Act, I think it is. And it came down from our federal government some years ago, like 2014, and we had to have it in place by 2016, I believe. And it specifically talks about not having young people coming out of schools in programs like this until they turn 25. So we already know that a lot of people with special needs sometimes stop at the age of 16. They stop at the age of maybe 18 when they actually, the time that most kids leave school, or they can go up until the age of 22 because of, the special education laws. Um, but if people need programs like ours for training, for you know, just having some place to be during the course of the day because they're no longer in school for whatever their reasons are, this law sort of doesn't allow students to be able or young people to come into our program, mostly because we are under the 14C certificate, which is a federal Department of Labor certificate we can get to pay special minimum wages to individuals with special needs while they're training. So it's special, it's not minimum wage unless they earn it because we have to do something called production ratings while they're part of our program. And this WIOA law puts such a gap between kids that are coming out of school or leaving or whatever, and when they can possibly come into programs like ours and do work training. Now, you can go to a day activity program all day long and get no wages and get no work training. But I don't know how that helps anyone if they want more of work related stuff. So we're going to need to begin maybe to talk with our representatives that's in the state to help us with our representatives that's in DC about what they can do to look at this because there are way too many kids now coming out of school who might not be getting the help and services they need in programs like ours. And you probably already know that if people sit still too long, after a certain point, they don't want to do anything. So they're out of school at the age of 22, 3, 4, 5 before they can come into a program like this and be in training because it pays special minimum wage. By this point, they have watched too much TV, played too many games, stayed home and raided the refrigerator too long. They don't want to do much. You have to get them when they are, fresh coming out of school, moving and stuff. Nothing bothers me more than kids sitting and doing nothing. And so I guess we could depend on our, representatives from our areas to assist us with this kind of stuff if you all know this and understand it right.
Yeah, like I said earlier, I'm a big proponent of advocacy, and I've taught advocacy training to different groups and things, and I always tell people, I said, never assume the politician or the public servant, whoever you're speaking to, knows what you're talking about.
I got
So
you right.
people always come to me with bill numbers and things like that. It's
Right.
hard to remember my bill numbers
I know.
from a bill that they care about, but maybe have not been coming through my committee or something
Hmm.
like that. And so I think the biggest thing is just again educating not only those that are making those decisions, but the public to, and
Hmm.
particularly those
Okay.
parents of those clients that you're serving, or the ones that we're leaving in that gap.
Okay.
About there are opportunities to get them off their couch, to get them from behind that computer, to get them learning a trade or learning skills
Hmm.
that will allow them to have an income.
Hmm.
And I just don't think people outside of your industry,
Hmm.
because I'm the
Hmm.
same thing. The farming stuff, I know that, and so I have to
Hmm.
do a better job when I'm speaking about it to educate folks what I'm talking about, and not
Right.
And of course, in the things that you do and we do, there's always a
Mhm.
lot of acronyms and all that
Right,
type of stuff.
exactly.
And so I just think that we just probably would need a very strong advocacy campaign
Okay.
to educate not only the state, but our federal delegation here
Okay.
about that need. And then, of course, bring in your partners. I mean, because we know when folks are idle
Mhm.
and sometimes not being as productive as they can be, they
Mhm.
may wind up places they shouldn't be. And
Exactly.
so,
Yes.
so
Mhm.
I think bringing in those partners in the community that are sitting in them places that they shouldn't be, and God forbid they be at our county jails or whatnot,
Exactly.
not getting
Yeah.
the services that they need because jails aren't service centers,
Mm-mm. They are not.
and too many of our folks that could have been end up there that could have benefited either from a program like this or from some
Mhm.
services that they just needed early on had they been identified. And
Exactly.
so I think that's a strong story to tell. I think
Mhm.
that's uh, something that folks should be able to get behind, regardless of
Okay.
what aisle side of the aisle you sit on.
Okay.
And because the folks that need help just need help.
They need help. Exactly. That's a very good point and stuff. And one of the things you mentioned about, people with special needs being in jails or prison, and that is not a service center and stuff, and a lot of people think people with special needs and can't go to jail. They don't end up in jail, but they do.
Mhm.
And you're right. And it's worse for that population probably than just a general population because of their special needs and stuff.
Yeah.
So,
Yeah, I
uh,
can remember growing up, we had a gentleman that worked at a local grocery store bagging and taking stuff out. And when that local grocery store closed, then you start seeing him walk the street and
mhm,
things like that because, like you said, his caretakers were at work during the day.
mhm.
And that could lead to an addiction and different things to where before you always saw him right there at that grocery store being as productive as can
Right,
be.
exactly. Very good. Well, we're definitely going to take you up on that one because that's something that we are feeling very strongly about that law that has come down from the federal government and what we need to do to begin to advocate, for the individuals who need that service and the young folks especially who need it. So, um,
And a good partner would they would will obviously be the schools, because
yes,
they would be able to identify them and
yes.
know which ones that should go right into a program. That's
Mhm.
particularly if they're leaving school at 16 or earlier than what they possibly
Right.
could stay there.
Exactly. So, okay, very good. Thank you for that. And then I had asked you about a particular thing that has sort of been a pet peeve of mine when it comes to some of the laws and whether it's a federal law or state law, and it had to do with programs like ours getting handicap stickers and stuff for
Mhm.
us to use when we take people to different places, whether it's doctor's appointments or if we have to do that or to events or out in the community. Um, the world is real big about folks in programs like ours going out in the community and doing things. And so when we try to do that, needing the handicap stickers so we can park as close as we can, oops, to the buildings and stuff, but we're not able to get this as a company anymore like we used to years ago, where I could go to the urgent care doctors that our insurance policy is under and get doctors to sign off. And so we could submit this to DMV and get our handicap sticker when we needed it. The last 15 years now, it's been something that I have not been able to do without almost begging someone, almost having to pay someone just to do this or something to sign off. And it's time for us to do it again. And I'm struggling getting doctors to do this. Urgent care doesn't want to do it. Family doctors don't want to do it because they say DECI is not the patient of their practice or whatever. And so they haven't been willing to do it. And I know a lot of group homes in Durham are also struggling getting theirs for their vehicles too.
Mhm.
And you said you would take time to
Yep.
look
So I
into that
looked
for me a
into
little
it,
bit.
and it may be again one of those things where it's education. As
Hmm.
administrations and things change throughout. We get new folks in that may not be as familiar. But from what I can find, and I'll have our staff there at the General Assembly kind of confirm. But our General Statute 20-37 point 6 has a clause in Section C that's about distinguishing play cards. A handicapped person may apply, of course, and then it says any organization which is as determined and certified by the state vocational rehabilitation agency
See?
regularly transports handicapped persons may also apply. And so it says these organizations may receive one removable placard per each transporting vehicle.
Hmm.
And so we just need to make sure that staff and DMV are aware of that statute, and
Mm-hmm.
be happy to put you in touch with our liaison there at the General Assembly.
Okay.
But that's what you all are, and so
Yes.
it's there in the law. So we just need to make sure they know that.
Okay. And who, like your liaison, what does that mean at General
So
Assembly?
each we have a department liaison that responds to us for constituent needs,
Okay.
and so we could reach out to that liaison, and they can get you in touch with the right person or get you on the right track for going ahead and getting these play cards there
Okay.
back. So yeah.
Okay. Very good. Because I would definitely follow up on that and let you know how that works and stuff because I did not know there was a statute or anything that talked about that. And obviously, the medical professions that we deal with don't know it either. So
Yeah.
I'd be happy to share that with them. But I did not know about vocational rehabilitation being involved. So that's good to know.
Yep, and it specifically speaks to organizations that are registered with the state.
With the state and stuff. And we are. So have to be in every year we have to pay a license fee to the state to say that, we can have our certification to be here. So
Yeah.
very good. Okay, then. So is it anything else that you would like to share with us today? I thank you so much for, coming and talking to us. But anything else that you'd like to share with us?
Yeah, no, absolutely. I thank you, for the invitation, and hopefully we'll have a state budget here pretty soon, and we can put this crisis to an end. But until then, we'll continue. Particularly, I know your Durham delegation is in tune to this, and we'll continue to work to hopefully not only get a state budget, but one that works for all citizens.
Exactly. Exactly. So, well, thank you very much. We appreciate you being here.
Thank you.
Okay.